introduction. Good morning, everyone. I hope you all are doing well. Yeah. Today I'm here to discuss my work on leveraging GenAI in healthcare. Before I start, let me narrate my personal experience, which I had recently. So, a couple of days ago, I was trying to book a doctor's appointment with one of the renowned doctors we have in the city. So I waited for so many days to get the appointment fixed with the doctor. So even after getting an appointment, I got certain time slot to visit on certain day. I visited the doctor on the time slot given to me, but I'm surprised to see there is a long queue, and I could not get a conversation done in the time slot given. I waited for so many hours, even after booking an appointment pretty earlier, to get a conversation with the doctor. So finally, I got my turn to talk to the doctor. You know what? I hardly got few seconds to talk to the doctor and narrate my health symptoms because the doctor was already overwhelmed by talking to so many uh, patients available over there, and I felt the conversation was so much rushed. After I came out of the doctor's room, I felt very regretful and thought I had to discuss so many things. I did not even discuss what all home remedies I have tried to the doctor, did not even narrate so many symptoms I was going through all these days, and I came out just in few seconds. That is when I felt, let me go to Google to search more and get extended advices. I even spoke to so many friends, family members. I even watched social media influencers talking about the same problem. But you know what? All of this caused a lot of confusion and anxiety in me. It did not lead to any conclusion or did not help me to get a better advice from all of these sources. So what is causing this trouble? Currently, in India, we have a very low doctor to patient ratio, which is 1 is to 830, I would say. And it is more worse in other countries. We all know this. This is a major problem. And the information available in all of these sources like Google, YouTube, is so much confusing and causing a lot of anxiety in patients who are going through several medical symptoms. So this frustration has led me to think through idea of developing an innovative generative AI assistant that is backed up by mixture of experts and intelligent retrieval system. So let me go back. What all existing approaches we have in the market right now? As you all know, I have gone through offline booking, so you might have also faced similar scenario in your case as well. Online booking, appointment booking is also similar, wherein you get chance to talk to only few seconds to the doctor and narrate your health condition, right? So the cost is also pretty much high, and you cannot get as soon as you want the appointment to be fixed. So online sources, I have already spoken from my experience, what all confusion it has created, how much misleading it is, and what all health risks it can cause if I adhere to those advices given in the online media, right? So the last option left with is traditional chatbots. Traditional chatbots are usually trained on rule-based data where they cannot understand complex scenarios and cannot remember your context for a longer duration of time. Hence, they cannot give you proper, tailored, and personalized advices which you are seeking for. So, our solution, the very intelligent MOE-based IRS-based system, is leveraging two major LLMs, the OpenBioLLM, MedLLM, which is widely trained on reliable data sources, and a mixture of expert system is formed, merging these two LLMs, and it is backed up by a RAG system, which is hugely trained on reliable and authentic medical database, And it is also trained on clinical Q&A, data set designed by medical practitioners. So the first LLM which we designed is OpenBio LLM, which is a Llama 3 OpenBio LLM, 8 billion parameter model. This was chosen as our base model, which is fine-tuned on several records of doctor and patient conversation. I would say around 257K records of conversations are trained on this model. And coming to the second model, the MedLLM, we have taken authentic clinical Q&A information, close to 16.4K records of information from clinical Q&A databases from Hugging Face, and clean and pre-processed them, and made sure our MedLLM is trained on this clinical Q&A data. Coming to the RAG-LLM, which is also a Llama 3 8 billion parameter model, which is backed by the VectorDB, which had a list of medicine and drug information and people's review on top of those drugs, which is scraped from authentic source of information like WebMD and this has been the embeddings of these medicines are pushed onto vector database, wherein RAG can retrieve those medicine information and formulate an answer along with the mixture of expert system. So our entire solution is further fine-tuned and quantized so that we can achieve optimal accuracies in real time. So after a lot of experiments, we have adhered to a certain list of parameters and their values. You can see them on the screen. Learning rate of 0.01, a batch size of 2, LoRa layers of 8, and iterations of around 50K, and epochs are 4, and we have made sure the fine-tuning of these LLM 1 and 2, which is OpenBioLLM, MedLLM, is done on simple, most viable personal laptop, I would say. A 48 GB M3 Max Apple MacBook is used for this. And we have made sure it is deliberately fine-tuned on most viable option instead of sticking to high-end hardware. So these fine-tuned models are really huge in size. So we have to compress them in order to push them onto cloud systems in real-time inferencing, right? That is when we have quantized them using Q5 KM using Llama CPP, so that we can compress them and fit into the lesser memory without compromising on accuracies in real time. So the OpenBioLLM, MedLLM, which we have chosen, are merged using merge-kit framework, so that it is used to, the merge-kit is used to prompt engineer and towards this model. And whenever a user queries a particular query, that query is understood by the router mechanism we have developed, and it is redirected to either LLM 1, 2, or amalgamation of all of these three, along with LLM 3, I would say, the RAG system. So we have designed a very lightweight UI, user-friendly UI using Streamlit for our prototype, and later on we went to Next.js for our production deployment. So you can look at some of the results which we have achieved throughout the process. So let me talk about strengths of LLM. As I told you, LLM 1 is trained on doctor-patient conversations. So the strengths of this model is to give you home-based remedies and basic care advices, so that the user can quickly get into curing those symptoms whichever he or she is going through. So LLM 2 is strongly trained on medical Q&A data sets, the medical jargon, symptoms, and diseases data set designed by the medical practitioners, so that it can identify the disease very well, and it can guide you through symptoms of those diseases, so that the user can correlate to what he or she is going through, right? So LLM 3 is very much excelled in providing medical advices. Basically, we have made sure only over-the-counter medical advices are given by the RAG, right? Because any AI system is not good enough or should not, in fact, advise any prescription-based medicines. For that, we have already doctors in the market. This AI assistant is generally designed to give you over-the-counter medical advices wherein prescription is not required. So MOE will combine the strengths of both of this model, and it can route the appropriate responses accordingly using the routing logic that I have designed. And it can even combine the logic of LLM3 by giving medical advices to the end user. We have achieved very good metrics over our journey. Perplexity score of 1.23 for LLM, and LLM2 1.42, and faithfulness, answer relevancy values are here, context precision, and recall. Till now, I have been just talking about designing a reliable AI assistant which is accessible and whenever you want, which is accessible whenever you want, and can give you personalized medical advices. Apart from this application, it can be extended further in the area of medical research and education as well. So this AI assistants can be used as a medical training kit to the doctors, which can help them to understand drug interactions and disease symptoms of several patients and can help them in their research data as well. It can also be further used as a second opinion advisory tool. It is quite normal. We as humans talk to one doctor and feel that, oh, I'm not satisfied with this particular opinion of the doctor. Let me go and talk to another doctor what he says, so that I'll be more assured of what symptoms or diagnosis, what symptoms I'm going through and what diagnosis the doctor has advised, right? So obviously they can come back to this assistant and get a second, very good second advice, which is very much authentic because all the source data is reliable and most trustworthy. It can also be integrated with telemedicine platforms where people can talk to these assistants first before reaching to the actual doctors, so that they can get a better picture of the health condition they are going through, right? So it can also be integrated with wearable devices where personalized notifications can be obtained, the diet plans or fitness advices, or the people's health records can be monitored and shown over the wearable devices. So it has many other applications. So these are the three major applications I have listed. So I'm very much delighted to close this session today. And I'm open for the questions if you have any.
So my question is, there are already general LLM like GPT 4 and above. So those are all trained on all medical data.
Yes.
So in general, if I ask a question, any medical question to it, or any other domain question, it is answering me that. And second thing is, there are some medically trained models like MedPalm and John Snow Labs. So any particular reason apart from the cost to not use specialized LLM or GPT higher end to develop this chatbot, and particularly you have decided to fine tune it?
Going with generalized models will not give you customized medical advices. So our main aim to go closer to doctor's appointment system, right? So any generic system will not help you with giving you a medical advice that are available on the OTC medication context, as well as it cannot analyze your huge and complex medical records to tell you what is the disease you are going through with the symptoms you are listing down, right? So that is why it is not ideal to stick to generic model. Rather than, it is better to fine tune with the actual authentic sources of data, because this is a very niche area, and it will put the people's health into risk, right? So it is ideal to fine tune it with the authentic sources of information rather than sticking to general AI assistants, I would say.
So, like I'm also working in medical domain. So we have explored this. I mean, there are options like MedPalm is there and John Snow Lab is there. So, have you also explored those models and compared this with the fine-tuned one?
Yes, yes, we did try with existing models, and we found the answers were not very much contextually relevant to the user queries that we are getting through the chatbot, AI assistant, I would say.
Thank you.
Yeah, I have one question about. So I have one question about how did you fine tune this particular model, right? Over here. Yeah. So the question is about whenever you try to talk about the like in conversations that you're having with a doctor. Now let's assume that a mid-aged person when he's having a conversation, maybe related to the same disease itself, or whenever you talk about a teenager when he's having the same conversation with a doctor, right? So the like in plan of action and then if everything will be quite different.
Right.
So how did you handle these scenarios? So when fine tuning your models. So would you be passing the metadata as well along with the conversations, or like, and what was the plan of action for this?
It's obvious, yes, yes, definitely. Entire uh, data of the patient will be queried first so that a personalized response will be given to the user according to their age, health condition, etc.
Okay, so that was also considered when fine tuning these models as well? Okay.
Yes, yes.
Okay, so the next question that I have is, so whatever the evaluation metrics that you were showing, right? So those were mostly with respect to an using an LLM as a judge, right? So have these responses been evaluated by human evaluators, more specifically
Yes,
doctors or
obviously,
clinicians?
this AI assistant is thoroughly audited and validated by medical practitioners in the end. In case AI assistants do not replace any human, right? They can, accelerate their efficiency by helping them so that the doctors can concentrate on more complex and niche areas and handle critical patients. So it is to reduce their overwhelming work so that they can further validate these kind of AI assistants as well as concentrate on critical scenarios.
Okay, okay. So just one last question. So, like, did you get
Any other OTC based medicine, if it has to prescribe anything beyond the OTC medications or anything beyond the home remedies, it will definitely ask you to go and talk to the doctor and get a prescription from them.
okay,
It will not advise on its own if it is very critical.
got it.
Sir, can we give somebody else a chance and you could connect with her later because there are other people also waiting? We can take just one last question. I'm sorry.
Yeah,
Yeah.
I just want to understand your thoughts on hallucination in the medical domain because I'm just thinking about the adoption of Gen AI solutions in the medical domain. So if you can elaborate a bit on that.
Yeah, that's why we have adhered to those metrics to in order to even cut down hallucinations. So if you look at those metrics, can show you how hallucinating the solution is in actual
I
scenario.
was talking more about the general medical domain itself. So, for example, there could be multiple solutions. So, for example, doctors, etc. Right? But we are talking about Gen AI solutions which have a limitation of hallucination, maybe in some form or another, right? So, just thinking about what is that impact on the whole domain itself. So, your thoughts on that?
That's why it is ideal to go with reliable source of information and fine tune your large language models and also run through so many experiments and achieve better metrics so that the hallucination can be curbed out.
Cool. Thank you.
Hi, Gayatri.
Okay.
So I just here.
Thank you.
Hello.
I'm really sorry. We are running short of time. But okay, all right. One last team. Can we take one last question? Okay.
Observation about having a patient going to a doctor to see and saying that you didn't have few seconds. Then I think it's important to remember, doctor does not have an entity who's walking in. Now, if he has a patient who's coming with a hernia, perhaps it'll take him 5 minutes to diagnose and say you got a hernia, you need an operation.
Yeah.
But that is not the same situation when you get a patient coming with a breast cancer.
Right.
You can't tell you got cancer, you're going to get treated.
Right.
It'll take him at least 45 minutes to 1 hour to actually explain and to have the empathy with it.
Right.
So I think one has to be very careful when you make a statement like saying that each patient, say that you go and see a doctor and are waiting for 2 hours.
Yeah.
There are reasons for it. Because patient
True.
doesn't know who's walking in.
True.
So I think one has to be very careful when you make a thing that, oh, I've been waiting 2 hours. People don't understand that aspect of it.
Right,
Just to
right,
make it
right.
clear.
We respect that doctors are already overwhelmed and so much overloaded in treating our patients because of lesser ratio. The idea is that we have lesser ratio and they are overwhelmed. I really understand that. They know doctors are really capable enough to understand how much time on each patient they have to spend, and based on the criticality of the patient. I truly respect that, understand that. Thank you.
Yeah, thank you so much, Gayatri. That was a great first half with some interesting and deeply insightful presentations.